Welcome back to SWGA Sickle Cell Awareness YouTube channel. I'm patient advocate Monica. If you're visiting for the first time, welcome. If you are a new subscriber, welcome to the tribe. In today's video, I'm going to tell you the 3 things that SWGA Sickle Cell Awareness is known for. The first thing is the Come Hub With Us event that happens every year in March. The second thing is let's game plan for sickle cell. We're talking about the complications of sickle cell. And the third thing is it's a family thing and you can learn to understand it. Let's get into the video. Come Hub With Us resource event is an event that I host every March. During this event, I provide resources for patients, their family, their friends, and their loved ones that they don't know that are available. And during this event, I also talk about the medical team that I know that every sickle cell patient needs. They need a sickle cell specialist, they need a primary care physician, they need a social worker, they need a nutritionist, nurses, they need to identify their caregiver, and they need to have health insurance. Let's talk about the team. Your sickle cell specialist knows everything about sickle cell. So they're going to come up with a treatment plan that tailored towards you. Every sickle cell patient is different and their needs are different. And every patient needs to know what treatments are available to them, treatment options. Because of the age I am and because I was diagnosed later in life, my specialist recommend that I take hydrochloride, and that's the medication and the treatment option that I'm currently taking. Your sickle cell specialist knows everything that's going on in the sickle cell community. What are the new treatment options? What treatment options are available? What medications are available? New medications that are available. And they're going to make the best choice for you and your situation. That's what I love about my sickle cell specialist. Each patient is different and each one of their needs are different. I've heard about patients being on Endari. A lot of patients that are on Endari, they love Endari. They say it works for them. I've seen testimonial after testimonial, and it works for them. I've seen people talk about the bone marrow transplant, stem cell transplant, gene therapy, and they're saying that they have been cured from sickle cell and it works for them. And I've even seen some patients say that they're cured from sickle cell. They no longer have sickle cell, and that is wonderful. That is amazing. And I'm so thankful that their specialist gave them that option or applied that option to them or provide that service for them. That is so important that their sickle cell specialist is available, is knowledgeable of all of the options that are available to their patients. Another position that is very, very important to the team is your primary care physician or your family physician. It is so important for a sickle cell patient to have a primary care physician. A primary care physician not only treat your symptoms, they also look into your family history and try to prevent what is known in your family, and they treat the whole person. That's what I love about a primary care physician. I remember at my first Come Hub With Us event, my primary care physician spoke, and he said something that was so profound. And I was thinking, wow. He said it is more cost effective to prevent something than it is to cure something. Let me say that again. It is more cost effective to prevent something than it is to cure it. And I was thinking, wow, I never thought about that. Another thing that I talk about, and it's something I recommend when I talk to patients and when I'm advocating, and it's something to consider. I want you to think about what it costs to go to a specialist versus going to a primary care physician or a family physician. When I go to a specialist and they write a prescription I take that same prescription to my primary care physician and say, can you write out me a prescription for this? Because it costs less when it goes to a primary care physician versus coming from a specialist. Some things, not all things, but some things that your specialist write out, I'm pretty sure your primary care physician or your family physician can write out, and it's more cost effective for you. I'm not talking something I've heard or something I've read. I'm talking about something I've experienced myself. I've taken a prescription from a specialist, and when I talked to my primary care physician, said, "Can you write out a prescription for this and more cost effective?" And I've seen the difference. It's just a recommendation. You can't do it with all prescriptions, but it's something that I do recommend if it's available. And you want to build a relationship with your primary care physician because he can prevent a lot of things, and he'll catch things before they get bad or they become unmanageable. And then your primary care physician can help you manage your health issues, your health care. That's what I love about my primary care physician. He tries to prevent a lot of things, and he makes sure that everything is under control. That is so important to me. Another person that you need on your team, I think, should be your best friend, and that is your social worker. My social worker is my everything. She is my best friend. Your social worker is the person that can get you what you need. When I was first diagnosed, I was unemployed and uninsured. Let me say that again. I was unemployed and I was uninsured. My social worker found an organization that provided my medications for me while I was uninsured and had no money and no insurance. This organization provided me all of my medications until I became insured. Also, I needed medical supplies because I have congestive heart failure. I needed an oxygen tank. I was on oxygen 24 hours. I needed a home tank and I needed a portable tank. My social worker called MRS Home Care and said she need this tank at her house before she get home, which means it need to be there in less than 2 hours. My social worker got that done. Your social worker can also help you fill out the paperwork that you need if you need insurance or if you need indigent care. If you have low income or no income, they can find resources for you to make sure you get the medical care that you need, or find a program that will make sure you get the medical care that you need and the resources that you need. That is so important. My social worker is my everything. I recommend a social worker. They are so important for your team because they're able to get resources that you are unable to get. And plus, organizations move quicker for them than they would you. I remember calling one of the medical supplies place trying to get some medical equipment and they couldn't get it. But as soon as my social worker called, they was on the way. They was on the way. So having a social worker is so important. Also having a nurse. Nurses can be in different places. You can have a nurse at your primary care physician office. You can have a nurse in the hospital. You can have a home health nurse. Your nurse is the person that helps you come up with a care plan. You and that person sit together and come up with a health care plan for you. What works for you? What foods, what medicines, what resources that you need, how can you improve this health journey, how you can make your journey easy, how can you make your health journey better, how can you heal better. That's what your nurse is for. Building that relationship, you both work together and come up with a health plan for your health journey. That is so important. Another person that you're gonna need that people don't think they need, and that's a nutritionist. Nutrition plays a big role in your health journey. I've seen the difference myself, and you can replace some foods with some medicines with food. I'm on folic acid. There are a lot of foods that are high in folic acid. I'm on potassium. There are foods that are high in potassium. I'm on a diuretic, so I cut the salt in my food. So if we can reduce the dosage of my diuretic, that would be great. So your Your nutrition is so important. Look at things that you can eat and change your lifestyle that will help you in your journey, your health journey, and make it easier and better for you. Another person that is so important is your caregiver. You need to identify who your caregiver is. Sometimes it could be a paid professional or it could be somebody in your family. Currently, my mother is my caregiver. It could be your mother, it could be your father, it could be a sibling, it could be a cousin or a relative or family member. But you need to identify who that caregiver is. And whoever your caregiver is, they're the person that's going to keep up with everything for you and with you. They're there to help you when you can't do things on your own or by yourself or when you need that assistance. It is so important that you work with your caregiver. Don't work against your caregiver, but work with your caregiver. That is so important. And caregivers play a very important role. So caregivers are great to have. And for those that don't have a caregiver, I think you have one if you haven't identified. It could be your spouse, it could be your best friend, it could be a neighbor, whoever it is. But make sure you listen to your caregiver, and they're going to be the ones that help you keep up with your doctor's appointments, your prescriptions, your foods, or whatever your needs are. It is so important that you work with your caregiver. Another person that is needed, and that is a person that provides your health insurance. You can go to different insurance companies to find out what health insurances that are available that helps you. Your health insurance is what's going to make your health care services more affordable for you. So you definitely need health insurance. You can go at it alone, look and call different health companies to find out what health insurance you can get, or you can talk to your social worker. Your social worker probably can refer you to a health insurance that would provide you with the right insurance that you need, or they can help you with the paperwork, or they can help you get health insurance. That is something that you need to consider. If you learned something in this video, make sure you subscribe and hit the notification bell for weekly uploads. I upload every week. Make sure you look at your medical team. Make sure you understand your medical team and know that you are loved. Love is one of those unspoken things that makes the healing journey so much easier, better, and faster. The next thing that I'm going to talk about is let's game plan for sickle cell. Managing the complications of sickle cell. One of the things that most people don't know is patients don't die from sickle cell. Most patients die from the complications of sickle cell. This was inspired by my love for football, and I didn't want to leave the male patients out. There are a lot of sickle cell patients that are males that love football, so I was inspired to do something for them as well. On the play sheet, the quarterback is the patient. The quarterback is the sickle cell patient, and the football is in the shape of a sickle. Hence, the football is a sickle. On the offense side are the complications of sickle cell. Not all of the complications, but some of the complications. And on the defense side are what treatment options are available for those complications. One of the complications that I deal with is congestive heart failure. And I see a sickle cell specialist as well as a cardiovascular specialist. There are a lot of patients that have sickle cell and have heart disease. So can you imagine trying to manage both of those, sickle cell, having a blood disorder as well as a heart disease? Another thing that a lot of patients deal with is diabetes. Not only do they see a sickle cell specialist, they also have to see an endocrinologist, someone who specializes in diabetes. And a lot of times patients have to manage having a blood disorder as well as having diabetes. It's a plan that you have to come up with your medical team. You get together and both of y'all can conquer this thing and master this thing, and you can manage both of them. Another thing that a lot of patients have is acute chest syndrome. Acute chest syndrome, you need a pulmonary and critical care specialist to manage this. Again, my recommendation is you talk to either your sickle cell specialist about this so they can refer someone, or your primary care physician or family physician, and they'll refer you to a pulmonary and critical care specialist to maintain and make sure that that acute chest syndrome stay under control. There are a lot of things that go on with a sickle cell patient, and another thing that's not on the play sheet, but it's something that I see patients experience a lot because they're constantly in and out of the hospital, and that is an infection. An infection can make things a lot worse. I remember working with a patient a few years ago, and they were so focused on his sickle cell and to the fact that they didn't know he had an infection until it had really, really got bad. And they had to rush and put him on a antibiotic intravenously. They had to send the antibiotic through an IV, and that was able to. They were able to get it under control, the infection under control, until he was free from the infection. So it is so important to look at managing sickle cell. And I know a lot of people, when they think about a sickle cell patient, they think about a patient that's constantly in pain and constantly going through or constantly in crisis. What I want people to do, or I want people to consider, that same compassion you have for cancer patients, have that same compassion for sickle cell patients. I want you to keep that in mind the next time you see a sickle cell patient. Have compassion and have empathy for that patient because it's something that they definitely need. The last thing that I'm going to talk about is it's a family thing and you can learn to understand it. A lot of times when people look at a sickle cell patient, they just look at the individual, and that's something that you shouldn't do. Sickle cell is an inherited blood disorder. Listen to the words that I'm saying. Inherited blood disorder. If a patient or a person has sickle cell, that means either their mother has sickle cell or their father has sickle cell. Either their mother and father have sickle cell, or they have the trait. One of the things that I hear a lot of people say is, well, Monica, I have the trait, so it's not a big deal. It's not a big thing. One of the things that I want people with the trait to consider, if you don't manage the trait very well, it shows up like the disease. You could experience severe dehydration. I see a lot of people experiencing severe dehydration. You can experience constant migraine headaches. You can experience jaundice in the eyes. And the biggest one is extreme fatigue. You're more tired than usual, or you're more tired than you normally are. No coffee, no caffeine, no sugar, no nothing can relieve you of that fatigueness or that tiredness. It doesn't give you the energy that you need because your sickle cell trait is active. And I want you to consider that when we talk about the trait. The variations are sickle cell disease, sickle cell anemia, which means either you have SS or SC, alpha thalassemia, beta thalassemia. I have beta thalassemia. Those are the variations of sickle cell. Someone in your family has it, and there is so much research out there now. There's more research than there's ever been. There's more information than there's ever been before about sickle cell. There are a lot of sickle cell organizations globally around the world. If you go on the World Wide Web, I'm pretty sure you'll find information about the sickle cell disease, the sickle cell trait, alpha thalassemia, beta thalassemia. Look up the information. Get to know more about sickle cell, especially if you know someone with sickle cell. More importantly, you have a loved one that has sickle cell. That is so important. In the comment section, let me know if you know someone with sickle cell, whether it's a family member, a friend, or a co-worker, or just someone you know in general. That concludes this video. Until next time, stay hydrated and stay well.